My name is HAMZA bin Khalid. I am student of medicine, fifth course. Today I am going to present you with the topic genetic disease that is presented by me, HAMZA bin Khalid. So first of all, we'll take notice on genetic disease. Traditionally, there are three types of diseases: genetical, determined, environmentally determined, and the third one is combination of both of two. Today, distinctions are blurred. Like up to 20% of pediatric inpatients have genetic abnormality, and about 50% of spontaneous abortuses have chromosomal aberration. And only mutations that are not lethal are reservoir of genetic disease. And if we talk about terminology, hereditary, this is derived from parents, and familial, it's transmitted in the gametes through generations. Congenital, present at birth, not always genetically determined. Example, congenital syphilis and toxoplasmosis. And if we talk like not all genetic diseases are congenital. Example, Huntington disease, third to fourth decade of life. And if we see about the classification, there are three groups of genetic diseases: disorders with multifactorial inheritance, that is polygenic; monogenic Mendelian disorders; and the third one is chromosomal aberrations. Number one, if we talk about disease with multifunctional inheritance, that is polygenic too, its influence of multiple genes plus environmental factors, relatively frequent, and diabetes mellitus, like we see in endocrine pathology. There is hypertension, gout, schizophrenia, psychiatric disease, congenital heart disease, certain forms, and some types of cancers also, for example, ovarian and breast cancer. Often familial occurrence probability of disease is in first degree relatives about 5 to 10%, and second degree relatives about 0.5 to 1%. So if we talk about gout, genetically impaired metabolism of uric acid, end product of purine metabolism, tissue accumulation of excessive amount of UA crystals, recurrent episodes of acute arthritis, precipitation of monosodium urate crystals inside the joints. And there is formation of crystalline aggregates, tophi, chronic destruction of joints, joint deformity, and renal injury also. And it's more in male than in female. Primary gout, 90% of cases unknown enzymatic defects. And if we talk about the secondary gout, that is 10% only, the known cause of hyperuricemia, like increased turnover of nucleic acids. Example, leukemias, chronic renal disease, increased intake, game, or you can say red wine. And if we talk about the morphology, acute arthritis, any joint, mostly hallux, abrupt and intense pain. What is the reason? Lower temperature. Chronic arthritis, permanent precipitation, tophi, inflammation, lymphocytes and histiocytes, destruction of cartilage, fibrosis of synovial membrane and kylosis. Kidneys, three forms: medulla, tophi, kidney stones. Tophi are formed in the vicinity of joints: bursa, olecraning, bursa, preepitelaris, auricle, and less frequently kidneys, other tissues. Urate crystals are soluble in water. Fixation in absolute alcohol biopsy. Turns polarized light. Patient with gout, obese, increased risk of hypertension, arteriosclerosis. Clinical presentation, if we see, there are three stages. The first one is asymptomatic presentation. Three stages. Okay, the first one is, and the second one is acute arthritis. Attacks of acute pain, days, weeks, silent periods, month here. Three chronic changes, tophi and colitis in 20%, chronic renal failure. And if we talk about the second type, that is monogenic Mendelian disorders, mutation of one gene. That's why it's called monogenic Mendelian type of inheritance. Today about 5,000 disease: autosomal dominant, autosomal recessive, and X-linked. If we talk about autosomal dominant disorders, both homozygotes and heterozygotes are affected. Usually heterozygotes inherited from one parent. Both males and females are affected. Transmission from one generation to other. 50% of children are affected. Familial hypercholesterolemia, subgroup of hyperlipoproteinemia, most frequent Mendelian disorder, 1 to 500, mutation of gene encoding LDL receptor 70% of plasma cholesterol, heterozygotes 2 to 3x elevation of plasma cholesterol levels, and homozygotes 5x elevation of plasma cholesterol levels. Heterozygotes asymptomatic until adulthood, xanthomas along tendons, sheaths, and coronary AS. Homozygotes xanthomas in childhood, death due to MI by the age of 15 years. If we talk about the Marfan syndrome, it's another example. French pediatrician Marfan in 1896, young girl with typical habitus. Abnormal protein fibrillin secreted by fibroblasts, part of ECM. Impairment of collagenous and elective tissue, decreased firmness of connective tissue. Principal clinical manifestation, three systems. The second one, if we talk about autosomal recessive, majority of Mendelian disorders, only homozygotes are affected, heterozygotes, parents are only carriers. 25% of descendants are affected. If the mutant gene occurs with low frequency, high probability in consanguineous marriages. Onset of symptoms often in childhood, frequently enzymatic effect. Testing of parents and animal cells. Ehlers-Danlos syndrome. Similar to Marfan syndrome, genetic defect of collagen fibril, several types like both autosomal and dominant and recessive. Hyperextensibility of skin, hypermobility of joints, contortionist joint dislocations, vulnerability, rupture of large cells, colon and cornea. If we talk about cystic fibrosis, 1:2000 live births, most common lethal genetic disease in white population. Defect in transport of chloridines across epithelia, increased absorption of sodium and water to the blood. Widespread defect in the exocrine glands, abnormally viscid mucus secretions. Blocked of airways, pancreatic ducts, biliary ducts. If we talk about pancreatic abnormalities, 85% dilation of ducts, atrophy of exocrine part, fibrosis. Pulmonary lesions, dilation of bronchioles, mucus retention, repeated inflammation, bronchiectasis, lung abscess, emphysema, and atelectasis 100%. And core pulmonary curriculum. GIT, meconium ileus newborn 25% and biliary cirrhosis 2%. Male genetic genital tract, sterility, obstruction of vas deferens, epididymis, seminal vesicles 95%. If we talk about phenylketonuria, absence of enzyme phenyl alanine hydroxylase (PAH), okay, increased plasmatic PHE since birth. Rising levels impair brain development. After 6 months, severe mental retardation. IQ under 50. Decreased pigmentation of hair and skins. Absence of TYR. Early screening test. And diet, mother's is PKU, increased level of PHE, placental transport, child with severe mental defect, although heterozygous, maternal PKU. Diet. Clinical symptomatology. Recurrent pulmonary infections, pancreatic insufficiency, malabsorption syndrome, large foul stool, hypovitaminosis like A, D, E, K, poor weight gain, high level of sodium in salty children, mother's diagnosis, death usually in 3 decades due to respiratory failure. If we talk about galactosemia, defect of galactose metabolism, lactose and plus glucose. Lactose is like less than glucose, defect accumulation of galactose in blood. Liver, eyes, brains are affected, hepatomegaly, fatty chain fibrosis, cirrhosis. Lens opacification, cataracts. Brain, loss of neurons, gliosis, edema. Symptomatology from birth, vomiting, diarrhea, jaundice, hepatomegaly. Later cataracts, mental retardation, diet. And another type is Gaucher disease, and this is the last of this type. Defect of glycocerebrosidase. 3 types. Type 1 is survival type, number 2 is lethal type, and the third one is intermediate type. Accumulation of glycocerebrosidase, kerosene, Gaucher cells, spleen, red pulp, liver, cyanosis, and bone marrow. And the third one of this is chromosomal aberration, like the cytogenetic disorders. Alternation in the number of chromosomes, autosomes or sex chromosomes, studied by cytogenetics, cell cycle arrested in metaphase, colloquine, staining by GIMSA method G bands, photographing karyotype. Two sets of 23 chromosomes, 22 pairs of autosomes, two sex chromosomes XX or XY. Cytogenic disorders are relatively frequent, 1 ratio 160 newborns, 50% of spontaneous abortions. Then we have X-linked disease transmitted by heterozygous mothers to son, daughter 50% carrier, 50% healthy. Son 50% disease, 50% healthy. Children of disease father, sons are healthy, all daughters are carriers. Hemophilia A defect of factor 8, hemophilia V defect of factor 9, muscle dystrophy, Duchenne disease. Structural abnormalities. Decades followed by loss or rearrangement, deletion, translocation. Generally, loss of chromosomal material is more dangerous than gain. Abnormalities of sex chromosomes are better tolerated than autosomal. Abnormalities of sex chromosomes sometimes symptomatic in adulthood. Example: infertility. Usually origin de novo, both parents and siblings are normal. If we talk about the clinical symptoms, mental retardation, IQ is less, like 25 to 50, flat face plus Epicantthus, congenital heart diseases, neck skin folds, skeletal muscle hypotonia, hypermobility of joints, increased risk of acute leukemias, mortality 40% until 10 years, cardiac complication. And in this type there is Klinefelter syndrome and it's very common. 1 ratio 1000 males. Additional X is either of paternal or maternal origin. Advanced maternal age history of irradiation of either of parents. Wide range of clinical manifestations. Distinctive body habitudes. Increased length between soles and pubic bone. Reduced body and facial hair. Gynecomastia. Testicular atrophy. Impaired spermatogenesis, sterility, rarely fertility, mosaics. Sex chromosomal disorders, a number of karyotypes from 45XO to 49 tetra XY, compatible with survival. Normally in females, one of X is inactivated. All somatic cells contain bar body. Male phenotype is encoded by Y. Tumors, if we talk about tumors, there are benign and malignant. Benign tumors, as all we know, hemangionemia, nervous flammers, port wine stains, lymphedema, hygroma, cholecysticum, and sacrococcygeal teratoma. If we talk about malignant, hepatopoietic malignant lymphomas, leukemia, C, hematopathology, neurogenic neuroblastoma, having sarcoma, primitive neuroectodermal tumor. And if we talk about sarcomas, there is rhabdo, osteokidneys, Williams, and thyroid. Specialized diagnostic therapy